Today's video is about Corynebacterium diphtheriae. The scene is about a Chinese restaurant famous for its corn dip. Corn dip sounds like Corynebacterium diphtheriae. Look at the large lollipop decoration. It also tells us about the morphological features of the bacteria. Just like the lollipop, the bacilli looks purple color under the gram stain, so it is gram-positive bacteria. Now the bacteria also looks just like the shape of the lollipop. Thus it appears as club-shaped bacilli. The bluish granules are metachromatic granules present on the bacilli. There are special stains for these metachromatic granules. You can see 3 pans on the wall. You can memorize the name of these stains by the word pan, which stands for Pond's stain, Albert's stain, and Neisser's stain. Since I have told you this is a Chinese restaurant, you can see some Chinese letters here. The bacilli are also arranged in a pattern called Chinese letter pattern. So mainly there are 2 important mediums used for the growth of this bacilli. For that, look at the waiter. He is telling someone to pay less. Focus on the word less. Less will remind you of the word LSS. LSS stands for Loeffler's serum slope. Additionally, you can see the waiter is a potato on a telephone. The word potato telephone will remind you of another medium called potassium tellurite medium. So in this Chinese restaurant, there is a chef named Jim who has a special menu called Jim Special. The word Jim stands for gravis, intermedius, and mitis, which are the 3 biotypes of the Corynebacterium diphtheriae. And the Jim Special consists of daisy, frog's egg, poached eggs, which are the characteristic colony appearance of the 3 biotypes gravis, intermedius, and mitis respectively on blood potassium tellurite agar. A man on the counter can be seen smoking cigarettes, and you know that cigarettes have products that are toxic to our health. So remember that this bacilli also produce toxin for its virulence. This bacilli causes diphtheria, in which there is a characteristic greyish-white membrane called pseudomembrane. Also, the man's face is not visible, so you can remember that faucial diphtheria is the most commonest type of diphtheria. On the table, there is a box of mayo beside a heart-shaped burger. This means that myocarditis is associated as a complication to diphtheria. In the fish bowl, you can see an eel, which will remind you of Eel's gel precipitation test, which is a virulence test performed to determine the pathogenicity by Corynebacterium diphtheriae. Like any reception table, there is a pen on the table, which will remind you that penicillin is the treatment for Corynebacterium diphtheriae. But also remember, for the cases, penicillin is the choice, but for the carriers, erythromycin is the choice. Thank you for watching. Do not forget to leave a like or comment to let me know if you like my content. Also, do share this video with your friends, and if you want to stay for more, do not forget to subscribe.